Today we're going to talk about transient global amnesia, TGA, transient psychogenic amnesia, TPA, and transient epileptic amnesia, TEA. All three will be explained in only 6 minutes. Meet Mr. X. He has some memory loss for last 4 hours. He went to a shop and returned few moments later. Since when, he cannot say his whereabouts. He has normal perception, normal behavior, and normal consciousness. That means there is no confusion. But he cannot recall the recent events. He is repeatedly asking where he is, what time it is, and what he has been doing. But the patient clearly knows who he is. That means intact personal identity. His partner witnesses the episodes and takes him to a doctor. The doctor is told that there is no history of trauma, epilepsy, loss of consciousness, and no abnormality has been found on physical examination. So, it confirms the diagnosis as transient global amnesia, that is TGA. Now, what is the diagnostic criteria of TGA? Duration less than 24 hours, discrete episodes of anterograde or retrograde amnesia, repetitive questioning, reliable witness, but normal perception, normal consciousness, there is no confusion, and normal behavior. There is preserved personal identity. That means disoriented in time and place, but not in person. There is no epilepsy, no loss of consciousness, no history of trauma, and no neurological impairment. TGA patients may also complain headache, nausea, dizziness, chills, fear of death, paresthesia, emotional upset, and chest pain, etc. Diagnostic criteria of TPA and TEA. TPA more or less same as TGA, but no repetitive questioning, and duration is more or less than 24 hours. On the other hand, TEA has discrete episodes of amnesia. Duration is less than 1 hour. There is multiple attacks. Onset while waking up from sleep. And epilepsy or seizure-like symptoms that can be motor automatism, repetitive grabbing, questioning, stereotype behavior, limb shaking, etc. The steps to differentiate and diagnose TGA, TPA, and TEA. If a patient has no recall of recent events, check the following criteria: anxious, repeatedly asking the same question, and no epilepsy or seizure. Duration less than 24 hours, reliable witness, absence of trauma, loss of consciousness, preserved personal identity. Then the diagnosis is transient global amnesia. But if patient has above features including no epilepsy, but no repetitive questioning, no time limit, then the diagnosis is transient psychogenic amnesia. But if patient is anxious, repeatedly asking the same question with epileptic or seizure-like symptoms, then diagnosis is transient epileptic amnesia. What are the risk factors of TGA? Age more than 55 years, age less than 55 years with migraine, vascular or psychological risk factors, insufficient jugular vein valve causing venous congestion. Treatment of TGA: reassurance, because patient will recover spontaneously within 12 to 24 hours. If patient does not recover within 12 hours, do MRI brain, which looks similar to this. So what are the top key points to remember from these slides? Short diagnostic pearls. No recall of recent events with epilepsy. Diagnosis is TEA. No recall of recent events plus no epilepsy. Check if repeatedly asking the same question. Diagnosis is TGA. If no repetition of asking the same question, diagnosis is TPA. Management and prognostic pulse. Reassurance. Patient will recover within 12 to 24 hours. If patient does not recover within 24 hours, do MRI brain. Thank you.